Neurologic pathology, West Nile. West Nile is a disease carried by a flavivirus. It has neurological symptoms and can affect men and horses. The mosquitoes are the propagators, and they are infected by birds that are the primary non-arthropod reservoir host for this virus. Horses and humans are dead-end hosts and don't amplify the virus in quantities sufficient to infect mosquitoes. In Italy, it is a seasonal disease that appears from June to November. The neurological symptoms in horses vary a lot. Headache, myoclonia, alteration in sight, serious lameness, shifting lameness, symptoms similar to laminites, exhaustion, loss of appetite, character changes, and asymmetrical ataxia. Subjects with ataxia can arrive at a 30–40% mortality. In this case, a pony showed neurological signs that progressively deteriorate over a week. Serious ataxia, exhaustion, appetite loss, muscular atrophy, myoclonia, and character changes. Moreover, when he tried to trot, he fell down. On the same day of this video, the pony was treated with allogenic blood stem cells intravenously, together with systemic ozonotherapy. The next day, he is still blinking. "16 hours after treatment, the pony is another, no more trembling, happier, and 70% improved in the ataxia. After a week, the pony has regained his appetite, is backing, and the ataxia has improved by 90%, and he was ridden for a few minutes where pathological hook hyperflexion was evident. On the same day, I repeated stem cells and ozonotherapy treatment. A week later, we can see the pony walking normally and he is preparing for the next competition. However, I repeated the treatment. His little rider said that he had never moved so well. His muscles have improved and he wants to work. In the third week, he left for the Italian Championship and arrived third in his category. He was so fit that 2 weeks later he left for a long journey to take part in an international competition where he did very well. In the last photo you can see him at the prize giving. The pony is better than he ever was, and after the trip his appetite was voracious and he was hyperactive. But how do stem cells work here? They are not an antivirus, but can reorganize the organism's defenses when the pathological process is still reversible. It has been demonstrated that if 12 horses are infected with the West Nile virus, only one shows the symptoms. Therefore, many organisms are able to defend themselves. But when there is a defense deficit due to another infection, to a vaccine, to a poisoning, or excessive stress, etc., the virus gets the upper hand over the immune system and evades it by mimicking the host genome to not be recognized as a pathogenic factor. In this stage of the process, the stem cells can still act by stimulating the immune system. Unfortunately, when the virus is able to activate the epigenetic mutations in the host immune cells, it makes them unresponsive to the virus antigens. In simple words, the stem cells, through their energy capacity, reorganize an altered structural physiological process, not a stabilized epigenetic mutation. I can explain better like this. The mental energy and the knowledge of a journalist, stem cells, can reorganize and clarify an incomprehensible article, disease, but is not able to correct it if someone has changed some of the keys on his keyboard, epigenetic mutations. Therefore, the sooner you apply the treatment, the greater the possibility is to reset the host immune system and inhibit the epigenetic mutations, directing the organism towards healing.